Stop guessing, start nursing. Writing accurate nursing diagnoses and prioritizing care using Maslow's hierarchy. Okay, today we're going to talk about how nurses actually think. Not how we memorize lists, not how we survive care plans, how we decide what the real problem is and what needs attention first. Let's start this cerebral workout. Here's the reality. If your nursing diagnosis is off, everything else feels off. Your goals don't line up, your interventions feel random, and your evaluation sounds like you're guessing. So accuracy always comes first. Before you even look at NANDA, pause and ask yourself, what did the patient tell me? What did I observe? What data do I actually have? Nurses don't pick diagnoses because they sound good. We earn them with evidence. The NANDA diagnosis describes the patient's response, not the medical diagnosis. Major depressive disorder is a medical diagnosis. Ineffective coping is a nursing diagnosis. And that difference matters because the care we deliver is completely different. Medical diagnoses tell us what the patient has. Nursing diagnoses tell us how the patient is experiencing it and what we as nurses can actually do about it. Related to tells us why the problem exists. It's the root cause, not the diagnosis repeated and not a symptom. Anxiety related to anxiety tells us nothing. As evidenced by is your proof. Pacing, poor sleep, anxiety rated 7 out of 10. Patient feels bad is not evidence. And I say that kindly. When written well, it sounds like this. Anxiety related to perceived loss of control is evidenced by pacing, restlessness, and anxiety, rated 7 out of 10. Another nurse should read it and immediately understand what's happening. For risk diagnosis, there is no as evidenced by because the problem hasn't happened yet. You list risk factors instead. This is especially important for suicide risk. Patients don't come with just one problem. Your job is to decide what matters most right now. We use Maslow from the bottom up. Physiological needs first, then safety, then connection, self-esteem, and growth. If the patient isn't safe or basic needs aren't met, nothing else moves forward. If a patient has anxiety, disturbed sleep, and ineffective coping, ask yourself, which problem is most interfering with safety and functioning right now? Often it's sleep or anxiety, because those drive everything else. Ask yourself 3 questions every time. Is the patient safe? Are basic needs met? What problem is causing the biggest issue right now? You may not write NANDA diagnoses every shift as a nurse, but you will think this way every day. All right, you're officially NANDA ready. Let's put it into practice.